Hi, I'm Marco Rubio, and welcome to this week's edition of Constituent Mailbox. As we do every week while we're here in session in Washington, we go through our emails and our letters. We pick a few that are kind of typical of the kind of information we're getting from you. We read them on the air. We answer your questions. So I encourage you to continue to write us because it does have an impact on us. This week, a lot of the mail has been about Obamacare, about the health care plan that passed about 2 years ago before I got here in Washington, D.C. 2 years later, the Supreme Court is now hearing oral arguments on whether the law is unconstitutional, and they'll make that decision. I have some pretty strong opinions about it. But I've gotten a lot of mail about the merits of the plan, and so I want to give you two differing opinions and then tell you where I stand. The first email comes from Kevin in Miami. He says, I've seen how Obamacare has been harming our economy. As your constituent, I ask you to please put a full repeal on the table. It will help jumpstart our economy and lead to more jobs. Thank you. On the other hand, Frederick in Boca Raton writes, as my representative in the U.S. Senate, I urge you to support in all ways possible the current Affordable Health Care Act. In addition, I would urge you to support efforts to enact legislation that would result in a single-payer system for health care in our country. Health care is in this modern society and right for each and every individual. Well, first let me say that thank you both for writing, and all of you for writing on this important issue. I understand health care from the perspective of a father, a husband, and a son. Unfortunately, as my parents have aged, my father passed away about 1.5 years ago. My mom, unfortunately, suffered some health setbacks last week. I've become a healthcare surrogate in the sense of helping her navigate the process of not just Medicare, but healthcare quality in general. And then as the father of 4 children, well, we pay some frequent visits to the pediatrician now and then, whether it's an ear infection or a flu, or from time to time an unfortunate fall or scrape here or there. The point is that we interact with the healthcare system quite extensively and have some strong opinions about it. Here's my observations. The first is our healthcare quality is the best in the world. We have the best doctors, the best hospitals, the best treatments, the best medicines, the best diagnostics. They can all be found here in the United States. You know why I know that? Because the richest, most powerful people in the world fly here to get their treatment. That's right. Heads of state from other countries, Saudi Arabia, you name it, fill in the blank. When they get really, really sick, they come here to get their treatment in the United States. There's nothing better in the whole world. Our problem is not our healthcare quality, it's access to it. And it's not just access to it at the emergency room, because at the end of the day, if you get really sick in America, you wind up in an emergency room and you get the treatment to save your life. The problem is how it's being paid for and how it's being accessed. Too many people don't have access to primary care. They don't have a health care home. So before they get really sick, there's a bunch of things they could be doing to keep from getting really sick, but they don't have access to a health care practitioner. Or they do have access in the worst possible setting because they're now very sick, but it costs a lot of money, and you end up, the taxpayer, footing the bill because they don't have insurance. The bottom line is our fundamental problem is not a health and care problem, it's a health insurance problem, and that's what we should tackle. The way I think we should tackle it is not through a single-payer system that would basically put every single one of us on a government plan. The way I think we should tackle it is pretty straightforward, and that's by having a competitive private market where individuals can buy insurance for themselves, either through their employee or out of their own pocket. Now, you may say that that kind of program doesn't work, but it does. I'll tell you one place where it's working right now, in the United States Congress. That's right. Your members of Congress, including myself, get their health insurance from such a marketplace. Every single month, as part of our benefits package, we pay X number of dollars a month for our health care. The federal government pays the rest on our behalf as our employer. And then we get to pick from 15 or 16 plans. Which one do we want? We get to pick one of these plans, and we get to choose the one we like. If we don't like that plan, we can leave it and go to another one. Now, if Congress gets that, why shouldn't every American have the right to do that? Why shouldn't you have the right to take your money and use it to buy health insurance from any plan in America that will sell it to you? I think you should. And by the way, when you take that money and spend it on your health insurance, why shouldn't you get the same tax break on that money that your employer does if your employer buys it for you? I think you should. And what about small businesses? What if we allowed small businesses to pool all of their employees together and together buy health insurance from their employee from any country, any company in America that would sell it to them? I think they should have the right to do that. These are the kinds of innovations that we need instead of Obamacare. And so what I support is not just repealing Obamacare. I want to replace it with common sense reforms that will allow every American to have more control over their health care dollars and allow them to buy health insurance for themselves. The kind of health insurance that's not just affordable, but that makes sense for them. That's what I'll be working on, and God willing, what we'll be able to pass here in Washington, D.C. Well, I appreciate all your emails and your input. It's really important on not just this issue, but all the issues that we're facing. We encourage you to continue to write us on these topics and look forward to working on them on your behalf. Until then, I want to thank all of you and to continue to encourage you to write us because you never know, maybe next week your email or your letter will be the one we read on the air. Thank you so much. May God bless all of you. May God bless the state of Florida. And may God always bless our great country, the United States of America. Thank you.